Actually, I mean, if you think about it, आपको एक smile मिली है.
Yeah.
Now you take a choice, you make a choice, you go to the surgeon and say that, okay, I want this XYZ smile, and he gives you, and now you want something else.
Yes.
Oh my God.
First of all, I ask my patient, what is the kind of smile you want? What do you want from me? Patient says, I want a good smile. Okay, show me your perfect smile, the picture which is in your mind.
And the top of it, dentist per se, because I mean, ये तो मेरी भी story है कि
I'll tell you, मेरी भी यही story है. You cannot implement, let's say, 5 or 6 kind of smile to whole of the population of the world. That's impossible. Huh?
yeah, smile and the world smiles with you, ऐसा कहा जाता है. और आज हमारे पास एक ऐसे डॉक्टर हैं जिन्होंने बहुत सारे लोगों की स्माइल सही करी है, या ये बोल सकते हैं उन्हें वो स्माइल दी है जैसा वो चाहते थे. जब मैंने उनसे ये पूछा कि सबसे इम्पॉर्टेंट चीज़ क्या होती है जब कोई भी पेशेंट आपके पास आता है और बोलता है कि मुझे ऐसी स्माइल चाहिए, तो आप उसे क्या कहते हैं? और उन्होंने इसका जो आंसर दिया उस एक लाइन में शायद लाइफ की हैप्पीनेस छुपी है. We have with us Dr. Kapil Khurana.
Thanks to you for inviting.
He is one of the very few dentists who shapes beautiful smiles in people. He is working in Moscow, in St. Petersburg, and now also in Dubai. इनकी सबसे इंटरेस्टिंग चीज़ ये थी कि इन्होंने डेंटिस्ट्री के साथ साइकोलॉजी भी पढ़ी. उस साइकोलॉजी के थ्रू इन्हें पता चला कि जब इंसान कुछ मांगता है तो वो क्यों मांगता है. जब उसे कोई पर्टिकुलर स्माइल चाहिए होती है तो उसे वो स्माइल क्यों चाहिए होती है. इन्होंने ये तक बताया कि क्यों हम सब किसी और की स्माइल देख के सोचते हैं अरे उसकी स्माइल कितनी अच्छी है. इन अ वर्ल्ड वेयर टीनेजर्स आर गेटिंग इन्फ्लुएंस्ड एवरी डे, उसमें स्माइल का क्या रोल है. मैं हूं डॉक्टर गौरव निगम और ये है डॉक्टर डैड टॉक शो. Hello, Dr. Kapil, and thank you so much for being here today.
Hello, doctor. Thanks to you. Thanks to you for inviting.
Yeah, I mean, there was a very short window. When I got a call that you are from Moscow, you're here in India, we had to, just have you here. And thank you for being here now today.
Thanks to you too.
So, I want to start with something very, very basic. Something which me as a pediatrician, as a child specialist,
Yeah.
बहुत बारी लोगों को मना करता हूँ. I'm talking about pacifiers. I'm talking about teethers. मैं मना नहीं करता हूँ teethers के लिए, but particularly I'm talking about pacifiers, teethers, excessive use of these things. क्या do you feel that there's a connection from this side to your side? जब तक वो बड़े होते हैं तो misalignment of teeth. Do you think there's a connection between these things?
I don't think that there is connection between these things. I know that there is connection between these things.
Oh, okay. You don't think you know for
You
sure?
know, as a professional, I should know for sure. No?
Absolutely.
After working for 27, 30 years,
Absolutely.
I should know for sure.
Absolutely.
Yeah, there is a connection. Yes, obviously there's a connection.
And then जब आपके पास बच्चे आते हैं and then they tell like what you see or what the parents are telling about the misalignment of the. In the history, do you find these things mostly happening in the childhood or?
Yeah, we do find such kind of things happening in the history. These things happen, but I personally have a little bit of different approach regarding my patients, being not only a doctor, not only a dentist. As you know, I have practice in Russia, I have practice in Dubai. And and as a doctor, surely you know that we have got different schools. We have different teachings. In India, we have got one school. Latin America second, so America that's another. Europe is different.
Absolutely.
And Japan is absolutely different.
Absolutely different. Yeah.
So, being member of all these communities, in my practice, I can find a perfect approach. Let's say I try to find a perfect approach to the individual, to the individual.
Okay.
So that it's not that it's in the books and we should proceed like this. So,
Correct.
And also being a psychologist, which I finished from Moscow State University and Oxford.
This is very interesting and I want to talk about this. Yeah. Go
Yeah.
ahead.
Approach to a child. First of all, you should approach not like a patient. You should approach like a small individual
Absolutely.
who is afraid of, कोई अंकल आ रहा है उसको डर लग रहा है या so that's the main challenge I see in my life. When they grow up, they are afraid of dentists, they are afraid of surgeons, they are afraid of doctors.
Yeah.
So that's it.
And the top of it, dentist per se, because I mean, ये तो मेरी भी story है कि
I'll tell you, मेरी भी यही story है.
for a very long time, like recently, I should not like say this on screen, but my first dentist visit was when I was like 3 years back. That was the first time I let somebody like poke things inside my mouth, because I was always very scared. And I do not recommend this. I tell people, please, your first dentist visit, मेरे हिसाब से should be when, I mean by first to second year of age, आप एक बारी जाके, just, I mean those are the guidelines that some people follow here.
Yeah, that's right.
Right. But having that said, there are two elements which I was thinking. I want to come to your very unique format of qualification that you have. एक तरफ आपने पूरी traditional dentistry करी, which is really nice, and then you jumped onto and you went for a psychology, which is a very strange combination, and then you connected both the things somehow,
Yeah,
and I think you focused your area of work towards people's smile,
yes.
which is
that's
great, like, right?
That's right.
So what is it? What happened actually?
You know, when you have experience of lots and lots of years and you keep on looking, I'll be very open, okay, to all these giants, all these companies who are selling their product and who are marketing their products just to sell it, right? You cannot implement, let's say, 5 or 6 kind of smile to whole of the population of the world. That's impossible. Huh?
Yeah.
That is basically 5, 6 basic smiles we have in our catalog.
Okay. So someone comes to you and says that I want this type of smile. Like I
Yeah.
can come to you and मैं बोल सकता हूँ कि this is the smile that I want and you will give me that.
No, I will not give you that.
Oh no, but normally people, people of your profession would do that.
Yes.
Okay. And what would you do?
I will talk to the person.
Okay.
So how did I come to this, right? I did a case of luminaires, and it was a big case of 24 luminaires. Each and every luminaire cost $2,000.
Oh wow.
$2,000.
You have to tell me a little bit what these are.
These are kind of veneers, you know.
Okay.
This is let's say Hollywood smile, which is
Okay.
the Hollywood actors they wear.
Yeah.
So I charge $2,000 for each and every
Single. Okay.
After 2 months, we signed the contract, we signed everything with my patient. After 2 months, my patient comes to me, doctor, I don't like my smile. I say, so what do you want me to do? So we have the contract. I understand everything and it's a real case. So what do you want? I want a new smile. I said, but why do you want it? She said, no, when I was choosing my smile, in the books, in the pictures, everything was fine. I looked Instagram, internet, it's the perfect smile you could make. But when I get up in the morning, it's not what I want. People are looking at me, they're kind of different way. So I'll tell you later what happened. So we redid the case, of course we did, and these things happen 3 or 4 times when people pay big amount of money. So I'll tell you how it happens, especially for the ladies. Okay. We come to a showroom, you go to the showroom anywhere with your wife, this gown, this dress, that's perfect. You buy this dress and after 3-4 days you say, no, this is not what I want. Does that happen in life?
Yeah, a lot of time.
Lots of time, yeah. And imagine this happens with your smile, which
Can
you
you
have
imagine?
to wear for whole of your life.
Yes.
You have to crown your teeth, you have to pay huge amount of money, you have to sit in the chair of the dentist.
Yes.
And after that you say, this is not what I want.
Actually, I mean, if you think about it, आपको एक smile मिली है जो भगवान ने दी है, it's fine.
Yeah.
Now you take a choice, you make a choice, you go to the surgeon and say that, okay, I want this XYZ smile, and he gives you And now you want something else.
Yes.
Oh my God. Okay, go ahead.
So what happens? कि generally when people they want a smile, क्या होता है? I looked at the smile of my friend, at the some actor somewhere in the internet, Instagram, anywhere. But are you sure that this smile, it's the thing which you want and it's going to be in harmony with your mentality? That's the thing I wanted to express to my patients.
Okay.
It's not that it's you just wear a smile and everything is fine. You should have a harmony with your smile. You smile is not what you want basically, yeah? You want to look good. You want to attract people towards yourself. And as you know, I live in Russia, yeah, and when some female comes to me, my patient, she's got a perfect figure, she's a model and it's a real case. Comes to me and says, I want to bleach one. It's perfect. Are you sure about it? She said, yeah. Everything is perfect with me, but my teeth, they are not of the perfect shade. I want bleach one. I said, I don't think that you want bleach one. She said, why? So I'll give you this smile. And after that, just imagine that people, they will start looking in your mouth. They will forget about your
Everything
figure.
else.
They'll forget who you are. They'll forget about everything. They will start looking in your mouth. Are you sure? You go back, think it over, 3 days. After 3 days, she comes to me, doctor, you were right. So let's do something little bit of lower shade. So that I don't lose my figure, I don't lose my individuality with my smile. These things happen when doctor, he is ready to sell any kind of smile to any patient. And I can give you lots and lots of samples.
Yeah, I get it. I get it. So you went so deep inside that, like you wanted to understand ki, what is the psychology behind that, and only that sort of response you give to the
Yeah,
person. Wow,
yeah.
that is intense.
So what does the patient wants in his mind?
Yeah, so individualistic,
So
right?
individualist.
And that is really sweet, है ना? होता क्यों है, मतलब since you are into psychology, why would I or somebody would want a different smile
Different smile from
from
your,
what you have already?
okay. There are different reasons. So first of it is social life. Well, it depends upon your occupation also. What is your on your job? If you are on the TV, if you have to attract attention, yeah. Especially when you are saying something and you want people to look at you, you need to have such kind of smile which is attracting, because from जब लोग आपके मुंह में देखते हैं ना, they start listening to you. This is kind of, point of attraction, that people look at you and they hear what you're saying. Agar you have crooked teeth, no, I'm not talking about you.
Yeah.
If a person has a crooked teeth, right, and you are reading some kind of lecture, yeah, and it's not what I want to look at. I will look at another place, right, and ultimately I will not hear you.
Yeah.
So this is kind of attraction. This is one of the reasons. Secondly, like in Europe, America, actors, and they want people to look at them.
That's more of a cosmetic reason.
That's more of cosmetic. And basically, you are right that Vinil's smile, this is more of a cosmetic reason. And one of the main things is that a good smile makes you look younger.
Yeah. Yeah.
And when you smile, in response, the world smiles to you.
Absolutely. I mean,
Yeah,
that's what they
right,
say.
yeah.
Yeah.
If you don't
Perfect.
smile, people don't look at you. You're a kind of gloomy kind of person. And why should I talk to a person who cannot smile?
सही बात है, बिल्कुल. So now let's go back to childhood.
Yeah.
We started where I asked you कि बच्चों को वो सारी चीज़ें करने से क्या malocclusion होता है and all of that, and therefore at a later stage, of course, that would warrant a certain format of treatment. Having that said, there's one particular thing that I wanted to ask you. Milk teeth. Okay. एक बहुत strong belief है सब में that if they are milk teeth, तो अगर cavity हो भी गई ना तो कुछ नहीं होता, नए teeth, permanent teeth तो आना ही है. And I'm telling you, I'm talking about the majority of people, they think this way that milk teeth are fine, थोड़ा बहुत अगर cavity हो जाएगा तो कुछ नहीं होगा, permanent teeth would be there, that they would come and everything's gonna be fine. It's like पुरानी history तो खत्म हो गई, अब तो नया start है. What do you have to say about that?
See, every case it's individual. We cannot say that this is right or wrong. Every case is individual. In medicine, basically, there's nothing like it's right or wrong. It's individual. What generally happens is we have a caries, right? And we leave this tooth. We don't extract it. We don't do anything with it. Let's say we take first part. We don't do anything. We have infection in this tooth, and this infection can come to the root. And from root, this infection can come into the bones and can carry on.
Okay.
Very simple example, right?
Just a continuity.
So, what happens if we extract it? Depends on at which stage this tooth is. What's the age of the child and whatever else. Yeah, we need to look at the X-ray and everything else. And if we extract it too earlier, the neighboring tooth, it inclines.
Oh, okay.
Then we have malocclusion.
Oh.
So, in any case, I recommend that you have a consultation of a good doctor.
Yeah. And because everything is very individual. And
Everything is.
and
You being a doctor, you cannot say one and the
totally.
same thing to each and every
Totally.
of the patient.
There's also a second angle to that whole story. लोगों को लगता है that अगर कैरी हो भी गई ना तो कुछ नहीं होगा आगे भी. And you answered it very correctly when you said कि वो infection can go down to your
Permanent
bone.
tooth.
Yeah, I mean that'll be a sequel to that.
Yeah.
So please don't think कि अगर it is just the milk teeth.
Temporary,
nothing like
will
that.
happen, yeah.
It has its
But
impacts.
in any case, keeping infection in mouth, it's not nothing good.
It's not good, right? Another thing is, let's move ahead and come down to the time when kids needs braces, or these days they say, what do they say? Invisible
Aligners.
aligners.
Yeah.
India में इस time पे there are these brands of invisible aligners.
Invisaligns,
Yeah, they have
etc.
come.
etc.
And a lot of time, even though not being a dentist, but मेरे से आके पूछते हैं यार एक तो braces हैं जो the wired ones and all of that.
Yeah.
And then there are these, but these are very expensive compared to this. That's what I'm not really sure, but these are the
I'll
questions,
tell you about
right?
everything, yeah.
Is it like one is good over the other, or what is the whole story around that?
In any case, I would say that aligners, they are more preferable.
Okay.
I'll tell you one thing. Let's be logical about everything in life. Yeah? Not talking about medicine. From medicine point of view, it's one thing. When we have really complicated cases, we go for braces, right? Depends upon the age and everything. I'll tell you about my daughter. At 10, her friend fixed braces. So she came to me, I want braces. Her mother came, I said, just stop. Not now, not now, not now. So she's 15 now. And more or less, the malocclusion, it's being fixed. So she will be 16 and will go for fixing all the teeth and just putting her occlusion at the right position, right? So depends upon the age also. And now coming back to the braces. What are braces? Braces are simply, let's say, steel points which are put on your tooth and they are fixed over there. And we start pulling this way, that way, anyway. So according to the physics, I know physicians are over here, right? People who know physics, yeah? When we start pulling from a single point, we always have chances of tearing the enamel around here, right?
Okay.
And from this point of view, aligners, if it's possible, they are more preferable because aligner is kind of cap, which is removable.
Okay.
So every time you have your food, you remove this cap, you have good hygiene, and this is, kind of more comfortable.
Absolutely.
And from the healthy point of teeth, right? These are more preferable because we don't push pressure on one single point.
Got it. Yeah.
एक जगह कोई लगा दिया, उसको इधर खींचा, उधर खींचा, and we have caries around it.
Makes sense. And also the hygiene purpose.
Hygiene
works, right?
purpose, yes.
That's
And
true.
one thing very special, braces, they are not for professional sportsmen. who are in sports, braces are not recommended because like basketball, football, anything,
It can lead to
if you
bad
get hit,
injuries, huh?
yeah, you can have a serious trauma with them.
But aligners can work well.
Aligners can work well.
That's right. And even they're so easily removable. So even
Yeah.
intense practices, people
Yeah,
can remove it.
yeah, yeah.
That sounds good. Uh, so this is where we're talking about, fitting and, trying to align the teeth and everything. There's also another element to this, you know, uh, especially with the teenagers. There's so much of social media involvement these days, and
Yeah.
there are filters everywhere on every app, and the influence that is coming from different angles. Everybody wants to look so perfect. Everybody is comparing themselves to the other person.
Yeah.
And ये सारी चीजें ना एक ट्रॉमा सा क्रिएट कर रही हैं. And therefore I want a different smile and I come to you. How do you deal here? Like जरूरी नहीं है ना कि हर किसी को एक स्माइल डिफरेंट उसकी जरूरत हो. There are so many times it's just because of the influence of these
Yeah.
other things.
Yeah.
How do you deal with that?
First of all, I ask my patient, what is the kind of smile you want? What do you want from me? Patient says, I want a good smile. Okay, show me your perfect smile, the picture which is in your mind, not on the photo, not in the internet. Just remove it. And if patient comes with husband, wife, mother, anybody, please move out of my office. We will talk to the patient tete-a-tete. Okay. So I ask the patient to show this picture which is in the mind.
Okay.
And then the second question is, why do you want such kind of a smile? What's behind this smile? So what is the aim which has to be achieved? So there are basically different kind of aims. You want to be attractive, or sometimes people, they don't want to have an attractive smile. They just want to have a simple, natural smile, so that people don't look at them. You know, it's there. Vice versa also. You have a perfect figure, yeah, and you have got a dashing smile. People will start looking at your smile. But sometimes you happens that you don't have a perfect figure, right? You are 150 pounds or something like that, and you have got a crooked smile. So people start, when you talk about something, when you start speaking, people start looking at you, and ultimately they look at your figure also. So because of different reasons, sometimes people just want to have a natural smile. So I ask, you want this? Okay, we are going for this, so that people don't look at you. You are behind the screen, that's okay. Be there, you're comfortable there, be there, okay? So sometimes, just for the younger generation, it's kind of sexy smile. One canine, it's little bit sharp, or it's little bit, kind of vampire smile or wolf smile. Sometimes it's a young smile. It's kind of depends if you go for, you're a housewife, okay, and the husband is a big businessman. He doesn't want to show off with his beautiful wife. Yeah, so you are at home, so you have got a youth smile.
Makes sense.
Yeah. So different kind of
I
smile.
get it. So speaking of different smiles, you're working in Russia.
Sorry, I'll tell you one thing more.
Yeah.
Which I generally tell my patient. Generally, all the time I tell my patient, I go, don't ever ask anyone, is this smile good for you? Don't ask for suggestion from anyone, because you are the only person who has to live with your smile, nobody else. If you get up in the morning, go to brush your teeth, look in the mirror, you smile to yourself, you like your smile, this is your perfect smile. Nothing else.
Nothing else.
I mean, ऐसा ही है ना?
बिल्कुल सही है. You have to live with that.
You have to.
become. So, in fact, my next question is kind of related. क्योंकि you are working in Moscow, you are working in Emirates. So, is there a different expectation of smiles when you talk about Moscow or Emirati smile or an Indian smile? I mean, as people, do they want different things?
Yeah, there is.
Okay.
Depends upon, there are different expectation of smile even in Japan. There is different expectation of smile in Europe. Between Europe, there is a different expectation of smile. Between Italian, Spanish.
Oh, okay.
And if you move to Sweden, that side of, there are different, and there is a different expectation of smile in America. That's where it came from, Hollywood smile.
Okay. So what is Hollywood smile, by the way?
Hollywood smile is all white teeth,
All white teeth,
all
nicely.
bleach,
Okay.
and the shape of the smile depends upon the personality of the patient.
Okay.
So that's the Hollywood smile.
And what is like an Indian smile, would you say?
It's more of a natural smile.
Okay, because I mean I don't think a lot of people are going to fix their smiles in India as of yet, or
Yeah.
are they?
No,
No, not really. You know?
you know, it depends upon the genes also.
Of course.
Yeah,
A
it
lot
depends
of
upon
it,
the
yes.
genes also.
So like you correctly said, you smile and the world will smile with you.
Yeah.
आप इतने सारे स्कूल ऑफ थॉट्स की बात कर रहे हो, स्कूल ऑफ मेडिसिन की बात कर
जी.
रहे हो, आप रशिया से हो, so why don't we just start there?
See, I'll tell you one thing. So, मैं रशिया में, I'm half Indian, half Russian. I'm Indian and Russian.
Yeah.
Okay. So, I know the difference between the Indian medicine and the Russian medicine. So, in my practice, I can implement both of them. Both
Yeah,
of them.
yeah.
मुझे पता चलता है कहाँ पे what is to be used, which system has to be used.
Okay.
I'll tell you one of the basic differences between Indian medicine and in Russian medicine, especially in the part of dentistry.
Sure.
So when we have kind of RCT, yeah, that is one of the biggest things.
Yeah.
What we do in Russia, RCT, we go for treatment of the tooth. हम पेशेंट को कभी एंटीबायोटिक्स नहीं देते, literally, because antibiotics they affect on whole of the body.
Yeah.
Yeah. मतलब एक दांत ठीक करना है, उसके चक्कर में तुम पूरे बंदे की पूरी बॉडी पे एंटीबायोटिक्स का इफेक्ट दे रहे हो. भगवान ना करे उसको कुछ ज़्यादा मुश्किल हो जाए, जहाँ पे तुम स्टमक लीवर को कुछ हो जाए तो तुम क्या करोगे? एंटीबायोटिक रेसिस्टेंट हो जाएगा वो तब तक, राइट? दांत ठीक कर सकते हैं until unless it's a very complicated case, yeah. And in oral therapy and even after extraction, we generally don't go for antibiotics. Local antibiotics after extraction, that is okay.
Okay.
So there are such kind of
Such
difference.
nuances are there.
So
Okay.
for that you have to come to Russia, study and have a look at this Russian medicine also. And when
Perfect.
you are perfect in Indian medicine, in Russian medicine, और भगवान कृपा करें तो आयुर्वेदा भी, you are the perfect doctor. मेरे को आयुर्वेदा नहीं मालूम, but I think that's going to be perfect.
Yeah, actually, you know, we had one guest on our show. She is she's an Ayurvedic doctor.
Oh, perfect.
And it was such an educational podcast for myself as well, when we were sitting and she was just telling things and I was asking. मैंने ना एक चीज समझी है, all roads they reach to Rome.
Yeah.
You have different philosophy. Eastern medicine, we talk about Chinese medicine, we talk about Japanese medicine. At the end of the day, I just feel everyone is talking the same thing in different ways.
Yeah.
We used to have one professor back in the day when I was doing my residency.
Okay.
And he would give us a stethoscope to wear. हम stethoscope पहनते थे. कहते थे, गौरव बताओ इस पूरे apparatus में जो तुमने stethoscope पहना है, इसमें सबसे important चीज़ क्या है? मतलब सबसे पूछते थे so and so, ठीक है. तो अब वो डायफ्राम है जो आगे के पार्ट से हम चेस्ट को सुनते हैं, वो है या जिस ईयरपीस है या ट्यूब है, क्या है बताओ. तो कोई कुछ बोलता था, कोई कुछ, उनका आंसर होता था ये जो दोनों ईयरपीस के बीच में जगह है ना गौरव, ये सबसे इंपॉर्टेंट चीज है, इसको सही करो. एंड आई फील विद सो मच ऑफ अप्रोचेस ऑफ डिफरेंट स्कूल ऑफ मेडिसिन, इट्स वेरी इंपॉर्टेंट टू हैव योर कॉमन सेंस स्ट्रॉन्ग.
यस,
है ना?
एब्सोल्युटली.
द आइडिया बिहाइंड द राइट नॉलेज इज ऑलवेज कि आपको ना राइट इंसान मिल जाए पहले. एंड देयरफॉर आई मीन who else than you who went to Russia in 91?
Yeah.
Was it USSR then?
It was the end of USSR.
It was the end of
You're
USSR,
absolutely right.
right?
Yeah. Yeah.
So, आप तब गए हो and probably you must have seen the scene evolving by now.
Yeah, exactly.
Right?
I was in that system.
You were in that system.
And I am in that system.
You are in that system. That जो parents India में who are trying for options to study abroad, medicine per se, उनके पास actually में options हैं क्या? So first of all, just would love to know your story.
My story. My story is very simple. I finished my schoolings. and told my parents that I'm going only to Russia, no any place. So my mom was against it. She said, you go to London, you go to America like everybody else. I don't know. I just want to know myself, because in Russia I will be out of control of my parents at that time. And at that time I came to Russia through an agent. और जैसे उस जमाने में होता था उसने पैसा ले लिया वो भाग गया और हमारा पहला साल खत्म हुआ so we were all told to go back to India so no money no admission nothing go back so पता नहीं पापा ने क्या करा किसको फ़ोन करा so few people हम रुक गए for studies so before sending student your children to any foreign country you should know the background of the person who is taking responsibility of this person मतलब आप अपने बच्चे को भेज रहे हो ठीक है वो भगवान की कृपा से हमारे पापा ने किसी तरह से ये कर लिया ये काम मुझे नहीं मालूम अब सबकी तो इतनी नहीं होती ना मतलब एक बार भेजने से पहले देख तो लीजिए ये बंदे की क्या हिस्ट्री है उस कंट्री में और इस बंदे की क्या हिस्ट्री है इस कंट्री में करेक्ट अगर इस बंदे की हिस्ट्री है इस कंट्री में उस कंट्री में कुछ हो गया तो आप इस बंदे को ढूंढ सकते हो इंडिया में ढूंढ सकते हो रशिया में ही इज योर परफेक्ट चॉइस सो बीइंग alone almost alone at that time so I could explore myself who am I and what can I do so it was it was very challenging it was very interesting and it's not was it is still very interesting
that's
life.
nice
Yeah
life hamsha interesting very
yeah so absolutely. I finished my BDS I finished MDS then I opened my first clinic second clinic third clinic I had a chain of clinics and without any single penny from my parents although they were ready to invest and just to help me but I said no I'll try myself so I took loan from the bank from my partner so ultimately I made a chain of clinics and at present moment it's a very good chain and later on I sold this and just at the COVID time so I thought I'll take a little bit of rest so I went for Oxford I went for psychology and then reopened it so I opened a new chain now I'm in Moscow St. Petersburg and Dubai so I'm in aesthetics basically for more than 15 years I'm doing only aesthetics it's not about aligners so I'm doing those cases where the patient is not forced to take the opinion of doctor basically when patient comes to me there's a kind of thought of patient so we should ask the patient what is your requirement instead of telling him you should do this you should that absolutely so first of all ask my patient what is your requirement so I go for it and if it's possible if it's not harmful for the patient we give him plus we explain the patient that such and such sequences you will have to come again okay in aesthetics that's fine so in short this is my life this is what I've got family over there I've got business I've got home and that's it
wow Indian scenario पे आते हैं एक बार
जी बिल्कुल
so many times so many people they want to become doctor in India and we have only n number of seats here कि अगर एक पेरेंट यहाँ पे अपने बच्चे को रशिया भेजना चाहते हैं पढ़ाई के लिए आगे what should be their steps how should they proceed बच्चे ने ट्राई किया and he wants to let's say whether he was not able to get it there or whether he wants to go there
okay
both ways nutshell यही है that he wants to go to Russia and wants to study there medicine
okay
what should be step 1 step 2 step 3 step 4 step 5
step 1 is you should find a reliable company which is based
okay
so that you have a person whom you can talk to in India I mean it should be if he is Indian that's good for you right
okay
and who is well based in Russia also because वो बंदा है जिसको इंडिया में भी जानते हैं रशिया में भी जानते हैं
okay
he is the perfect person secondly
for that question only इसका क्राइटेरिया क्या है मुझे कैसे पता चलेगा लाइक मैं एक पेरेंट हूँ मैं तो जाऊँगा गूगल पे आई विल जस्ट ट्राई टू सर्च like I want to send I will find so many numbers I'll call what are the different like what will tell me that हाँ यार ये बिल्कुल सही है
वो तो आपको चेक करना पड़ेगा. जस्ट कॉल दिस पर्सन, उससे पूछिए तेरे रशिया में क्या कॉन्टैक्ट्स हैं, हु आर यू ओवर देयर, क्योंकि बच्चे को आप भेज रहे हैं रशिया, राइट. बच्चे को कुछ जरूरत पड़ेगी हेल्प की, तो दिस पर्सन शुड बी समवन ओवर देयर,
Okay.
कि उसके कुछ नाम हो, उसके कुछ कॉन्टैक्ट्स हो, ही शुड बी एबल टू हेल्प योर चाइल्ड ओवर देयर.
Right.
एंड वन ऑफ द मोस्ट इंपॉर्टेंट थिंग इज, जो भी कंपनी के आप थ्रू भेज रहे हैं, इट शुड बी लीगल,
Correct.
it should be registered in the Ministry of Education, it should be registered in the Ministry of Health, because we are going for MBBS. This is
Where are
under,
you talking about in Russia? They
in
should be
Russia, of
registered
course,
there. Okay.
of course, of course. So these are the main criterias.
And how do people find out if they are registered or not? On internet, it's available.
On internet, you can go to the site of the Ministry of, you can ask for any kind of document.
Okay. Okay.
And if you want to be sure that this is authentic document, go to the site of the company, go to the site of the ministry, or just ask for anything that is workable.
It's always best to ask for everything possible rather than to feel sorry later.
Yes, you're absolutely right.
Yeah.
Absolutely right.
Normally, what is the landscape of Russia in terms of medicine? Like different parts of Russia, which one is better? Which one is it? Something like that?
More or less, the education in Russia, it's standard protocol. It's
Okay.
standard. But at the present moment, as the student comes from India,
Yeah.
main thing which matters is the weather.
Okay. Yeah.
किस मौसम में पहुंचा बच्चा,
Okay.
जिस सिटी में उसको भेजा उसका इकोसिस्टम क्या है, लेवल ऑफ द सिटी. एंड
When you see so many children coming from India, what are the challenges that they face? क्योंकि ये बच्चे हैं 12वीं तक यहाँ पे पढ़े, 12th के बाद they just take this transition and they go there. नई country, नया culture, सब कुछ नया. What are the and weather?
Yeah,
So
weather.
what are the real challenges that?
challenges is, I'll be very open. जनरली उनके साथ कुछ बच्चों के साथ आई गिव यू टू ऑप्शंस. ओके, होता है धोखा. लोग जो एजेंट्स लेके आते हैं उनसे पैसा ले लेते हैं, एंड यू नो दे हैव टू बाय सम क्लोथ्स, warm clothes, right? The thing which costs 2000 in the market, they will sell them for 2500, they will sell them for 3000. Margin they keep to themselves. Instead of coming to the shopkeeper, tell them we want 50 pieces of warm clothes, give us 50% discount. And then foods, clothes, shelter, these are basically the challenges which children see when they come for the first year. Then they get adapted, they can do anything themselves.
Okay.
But we, in any case, we try to keep each and every student under our vision, not under control. कि हमें पता रहे कि हाँ ये कोई गलत काम नहीं कर रहा, कोई कुछ नहीं कर रहा.
Okay.
And the best part is that according to the rules, जो भी बच्चा आता है वो कुछ 2-3-4 घंटे दिन में काम कर सकता है.
Okay.
So you can earn something.
Okay.
So let's say approximately 500 rupees per hour can be earned.
You're talking about rupees, rubles?
Rupees, I'm talking to
okay.
in rupees. Rupees. So,
Okay. Right.
so that's it.
Okay. Perfect. तो when they come there, normally, okay, हम ऐसे करते हैं, ये बच्चा है, इसने हम जो जर्नी बना रहे थे, बच्चे ने डिसाइड किया उसको MBBS करना है, उसने सही जगह पे बात करी, अब वो बच्चा रशिया पहुंच गया मान लेते हैं, ठीक है, तो how does the initial days look like? Like क्या वो हॉस्टल में चला जाएगा कॉलेज के, या उसको बाहर लेना होगा? How does that work? Or both are options?
नहीं, this is not the case when both are the options.
Okay.
क्योंकि बच्चा जब पहुंचता है, before coming, he should know where he will stay.
Of course, yeah.
Parents should also know. It's not like that कि वो सड़क पे खड़ा मैं हॉस्टल जाऊँ मैं अपना लो.
बिल्कुल.
वो बाद में कर सकता है if he wants to change after
Okay,
2-3 years.
okay.
That's second option.
Okay.
Yeah.
तो इस टाइम तक बच्चा अपने अकोमोडेशन में सेटल हो चुका है, कॉलेज स्टार्ट कर चुका है.
Yeah.
All of that has already happened.
Yeah.
Okay. And in between he can do some part-time work to gain some extra cash.
Yes, and experience also, because
experience
part-time
also.
work can be done in your, in your specialty also.
Yeah, in your own university there are so
Yes.
many options.
Yes.
Perfect.
Yes,
Mostly
sir.
what happens is like once they've done their medicine in Russia, where all they can actually practice without giving exam.
I'll tell you the best part of it. Lots and lots of Indian workers, manpower is coming to Russia at present moment, right? And everybody knows about it. Then why don't the students who are doing MBBS over there stay there and get a job as a doctor? I think that's a good idea.
That's a good idea, but then they don't do that. A lot of them come back, right?
They have to take exam, but that's normal. Whenever you go to any other country, you have to take your exam, and you have to prove your qualification that you're good enough to work with the patients. That's normal.
So just like with any other country,
Yeah.
once you have done an education in a country, like if I have done my, let's say, medicine in India and I want to go and practice in the US, I have to take certain exams, right? Likewise, the same thing is with Russia. When they go out, they have to apply for these exams and then they can practice in different countries. How about Europe for that matter? Like, over there also the exams are needed?
Exams are needed also, but from Russia to Europe, that's much easier.
That's much easier. Because I've listened through a lot of friends who have like shifted to Germany and other places like I was just telling about. So they have moved from Moscow to Germany and did their masters over there.
And the best part of this is that student who has finished his MBBS in Russia, and if he moves to Europe, the Russian community over there is going to be his part of patients. Indian community also. So he will have a much more larger community of patients and to work with. Yeah,
makes sense.
Makes sense.
A very crucial question when people think of Russia is how cold that place is.
Yeah, that's normal question.
Can you tell us certain stories around students?
See, I'll tell you one thing. बाहर -20 हो, right? मैं इंडिया पहुंचता हूँ, मेरे को ज़्यादा ठंड लगती है. I'll tell you why. क्योंकि दिल्ली में +10, right? बाहर निकलो +10, घर में घुसो +10, सुबह +10, शाम को +10, मतलब ब्लैंकेट से बाहर निकलो +10 हो गया, right? मतलब your body is in this stress condition for 2 months. You're feeling cold. And I'm not talking about heaters. वो तो ठीक है, that is second thing, just for normal person, right? Russia में whatever it is, it's let's say -10, -15 outside. But when you enter in any building, it's +23. बाहर जितना भी temperature हो, student in his hostel can sleep comfortably in shorts. मतलब बॉडी को टाइम मिल जाता गर्म होने के लिए. So it's not such big stress.
So eventually आपने कभी ऐसा नहीं देखा कि उसकी वजह से बहुत प्रॉब्लम हुई हो and kids want to come back?
नहीं.
Weather is not even like on a list.
घर पहुंचो गर्म है, पढ़ाई करने जाओ गर्म है. Any building you enter, it's centrally heated.
That's really nice. So all of this education that you're talking about, then जब बच्चे को वो रशिया भेजना चाहते हैं, जब तक बच्चा एग्जिट करके एक डॉक्टर बन जाता है, how much does it normally cost?
Well, it costs, I'll tell you, per year. The price is, let's say, in Indian currency, just let me try, 4 lakh, starting from 4 lakh per year. The payment can be made per semester, 2 lakh per semester. And ending, let's say, 3-4 times more. But there is always, golden center of it, the perfect part. You don't spend much money, but you get very good quality. So for this kind of students, I generally recommend that there are good universities. They charge around 6,50,000 rupees per year.
Annually. Okay.
Annually. And hostel charges is around 7,000 per month. Okay.
7,000?
Rupees.
Oh.
Yeah.
Okay.
Regarding mess and food, it depends on individual, but let's say it's approximately 7,000 to 10,000 rupees per month.
Okay.
और कितना बच्चा खर्चा कर लेगा वो उसकी मर्जी है, वो
तो फिर
कैसे
there's no
रहेगा.
limit है ना? बिल्कुल.
No limit.
So approximately by this metrics, it will come around, if you're talking about 6 into let's say 5, so 30 to 40 to 50 के बीच में.
Yeah, let's say from 35 lakh onwards. And 60 lakh. That is the perfect.
Bracket.
That is the bracket, yeah.
And mostly the costs are expensive when we talk about places like St. Petersburg and your Moscow.
They are much costlier.
They are much costlier. They would go beyond 65, you mean? Or
yeah, they will go beyond 65.
Okay. So when we talk about that bracket, what you're talking about, which places would those be?
those places, regarding the quality of level of education, I cannot say that they are going to be much higher.
Okay.
But they can be much higher regarding the quality of extracurricular services.
Okay.
And but for a student who has come to study, who has come to learn, I think all these extracurricular services, they are not much in demand. They are not
Yeah, I mean the combined.
लोग फालतू का पैसा खर्चना ना,
बिल्कुल,
मतलब
बिल्कुल,
he's
बिल्कुल,
got
बिल्कुल।
some, let him study.
Absolutely. We have one sentence for you to finish. Finish this thought for us, okay? The most beautiful smile you have ever created wasn't the most perfect one. It was the one where dash. What is that?
Where the patient looked into the mirror and fell in love with himself or herself.
Oh, wow.
जहाँ पेशेंट को शीशे में देखते ही अपने से प्यार हो जाए, that is the perfect smile for the person.
Sounds awesome. Yeah, I mean, that was a very interesting talk on different type of smiles and when should one seek for if they think that they need a change in the smile. Thank you so much for being here.
Always welcome. Always welcome.
अगर आज का एपिसोड आपको अच्छा लगा हो, आपको लगा हो कि इसमें कुछ भी वैल्यू थी, तो प्लीज शेयर करिए. एंड इफ यू हैव नॉट हिट दैट बेल आइकन येट, तो प्लीज करिए.